So the PEPFAR program is celebrating its 20th anniversary this year. And without the benefit of a vaccine or a cure, we've managed to bring HIV to epidemic control or near epidemic control in most of the countries that we operate in. However, our mandate is not to end AIDS, but it's to end AIDS as a public health threat. And we've committed ourselves to doing that by 2030. And we are not quite where we want to be, but we're still relatively on track to do that. I say that because the response has been heavily donor dependent. We've created parallel systems. We've done things ourselves. We had to do these in an emergency way so that we get the epidemic under control. But the future is going to have to deal with less donor funding to do that. And we are operating in countries that simply don't have the public fiscal space, despite the importance of public finance, does not have the fiscal space to take on the full response in the future. And so they're necessarily, we're going to have to use private sector solutions with private capital to do that. So the good news is that there's an entire program of opportunities out there for different private sector solutions. On the downside, though, we have a lot of structural barriers for government bureaucracy filled with public health professionals and doctors, and so we don't think as creatively as we should. So we understand that there's a role for the private sector. We understand that there's a role for private finance, but we don't always have the ingenuity and innovation to figure out where those are. On the other hand, particularly when we're talking about women, the demographics, particularly in generalized epidemics, skew heavily women, and a lot of the health sector are populated by women. So there are extra opportunities here, particularly with gender-based funds, that can really unleash their innovations, their technology. And we don't, again, always know where those are and what they could be. They could be everything from service provision to the systems needs, to even some things that we today think are public goods. And so, as I say, we have these structural barriers, but we also have the knowledge that we won't be able to do it alone. And we are thinking about different ways. Our ambassador, John Nkengasong, is pushing us to think and take risks. Again, not something that government bureaucracies do well, and we're going to have to create parameters around how we take those risks. But we have been looking at blended finance models, finding ways to use the PEPFAR platform and the types of investments that we made that will de-risk investments. We're trying to find partners and other parts of the U.S. government that can come along with us to bring some of the startup financing. We can always provide technical assistance. So there are lots of different ways that we can be helpful. But again, we're really looking to the outside to help us think through where those opportunities are and where sort of the biggest bang for the buck is. Again, a lot of our attention is going to be focused around achieving the public financing that is going to be core to this. This is within an envelope that nobody feels is ever enough. And so we have to be realistic about what we can do. But again, this has to be core to our work. I look to all of you to help us think through how we can take these things forward.